More than 100 million Americans are at higher risk if infected with coronavirus. Health officials say the people over the age of 60 are more likely to develop medical complications if they get sick with COVID-19. That's also true for people who have certain pre-existing medical conditions. So the Kaiser Family Foundation tried to count people who fall into those categories. It estimates more than 105 million Americans are in those two groups, most, of course, older Americans. Doctors are learning more about the coronavirus and what it actually does, to your body. What happens when you're infected? Dr. Reena Mehta joins us now with more on that. Good morning.
Good morning.
So your body goes to war with this, and the virus goes to war, basically.
Exactly. So coronavirus are a family of viruses that have been around forever that cause the common cold. There are 7 known strains of coronavirus that can infect humans. This particular strain, COVID-19, actually originated, as we know, in Wuhan, China, and since then has started replicating from person to person.
Life has changed so much in the last several days, and I think maybe we in the media, one of the things we should have emphasized more is novel coronavirus, a new virus. We don't really know how it will react, and there is the reason this is such a big deal is there's no immunity.
Exactly. So we don't know a lot about this virus. All we can speculate is what we know about other coronaviruses and other viruses during this time period. So what we know about coronavirus is it has spiked particles or spiked surfaces, otherwise known as corona or crown-shaped. And because of this spiked pattern on the coronavirus, it can easily attach to cell receptors in the body. Once in the body, the virus can spread and replicates very quickly.
All right. So let's step back for just a second, because I think that, we were talking about this before. The problem with this is it's a little like hurricanes when they come. On the one hand, you want to take them very seriously. On the other hand, you don't want to panic. So how do you strike the balance? Because the fact is, most people, 2/3 of Americans anyway, if not more than that, are really okay here.
So it's good.
Individual.
Exactly. So don't panic, but it's important to be concerned. There's a reason why CDC is having recommendations, doctors are having recommendations, because this virus is spreading very quickly. What we know is that the way it's transmitted is through respiratory droplets. So that can be through respiratory droplets with close contacts. Those people who are 6 feet away, who are infected, can actually transmit the viruses, and it can stay alive on surfaces for at least 2 to 9 days. So while common disinfectants can kill the virus, there are people who can actually get the virus once they're infected. It can have an incubation period of 2 to 14 days. So there are people who can actually be transmitting the virus and having it and not even know that they're spreading it.
Well, and I guess, if you want to go down a really strange tangent with me for just a moment,
sure.
There's a theory that in history that many more Native Americans were killed by diseases that the Europeans brought over than were ever killed by gunshot or by war. The point being that with no immunity, a population can, in a hurry, it can spread and devastate entire villages back in those days.
Exactly. As you mentioned, this is novel. We have no antibodies and no protection against this virus. There is no vaccine. There is no treatment. Now, while these studies are underway, we are vulnerable at this time period, and it's contagious. And so being smart about the things that are being recommended, social distancing, disinfecting, cleaning surfaces, staying home if you're sick, washing your hands for at least 20 seconds, those are what we know can kill this virus, because right now, that's all we have to reduce the transmission.
And I don't know if we can emphasize it enough at this point. It's if you're 25 and healthy, you don't have any issues, then you really are probably okay. Maybe even better off than if the flu. It's the other.
Exactly. So at that age, and children, as we know, are doing exceedingly well with this. You get the coronavirus if you were a child or a young adult, but you may be asymptomatic or mildly symptomatic. Who we're concerned about getting the virus by spread of kids are those who are immune compromised and elderly, and passing it on to somebody else.
Dr. Reena Mehta, thank you.